Hi, this is Dr. Alissa Gould with All Spine Chiropractic and Wellness, and we are going to talk about myofascial release scraping therapy. I like to describe fascia as a saran wrap material that wraps around each muscle group. I believe it's supposed to act as a lubricant between each muscle group so that it does not create friction rub as they activate and provide movement for our body. However, over time, with dysfunctional muscle patterns, positioning, or injury, we start getting adhesions between these layers, which causes reduced flexibility, increased tension, and reduced overall blood flow. Scraping is a myofascial technique that uses a tool to break up tension and adhesions within muscle, tendons, ligaments, and fascia. A scraping tool can be made out of bone, stone, or stainless steel. A lubricant is used to help glide the tool across the skin and fascial layers. I like to use a lotion that does not have any perfumes or essential oil to prevent skin irritation. A lot of people may like to use a magnesium oil or some type of essential oil, but I have a tendency to stay away from that to reduce irritation on my skin. The scraping tool is then used to glide across your skin. The areas that you feel that are more textured or tender or crunchy, those are the areas that you want to focus your scraping tool on. In this video, you see me move my shoulder, my neck, or my jaw. I'm doing this to increase tension or to add to the input that I'm getting underneath my blade. I'm not putting a ton of pressure underneath my blade. It's just pretty much, honestly, the weight of the blade that you really use. And wherever you feel grittiness or that weird texture or even some soreness, that's where you want to focus your attention to. But moving my head, moving my shoulder, moving my jaw, all of that adds extra tension or a different type of input, output underneath the blade that allows me to find those bad areas. When we are scraping, we're trying to get a little bit of a petechiae response, meaning that we're getting increased redness or peakness in the area. Again, it's not a lot of pressure. Some places I do add a little extra input or push into the blade as I'm gliding it across the tissue, but really you just want to get that blood flow and reduce tension underneath your blade. So you don't spend a lot of time in one area. You want to make sure you're moving the blade and gliding it through the tissue and moving on to the next area. Following scraping, it's recommended that you stretch. That way you are flossing the tissue that you have just reduced tension on. So it allows you to kind of add more input, allowing your tissue to stay that way because you just broke it down. So then we want to make sure that we floss it by stretching. Following scraping, it's also recommended that you drink a lot of water. With scraping, you increase inflammation, you increase blood flow, but you've also released the toxins that have been within that dysfunctional tissue. So you want to drink a lot of water so that you can help your lymphatic system release and detoxify. That way you aren't as sore and don't feel as sick following scraping. I mentioned feeling sick following scraping, similar to getting a massage. If you haven't had a massage in a while and haven't released your body chemicals, then sometimes you can be more sore, you can kind of feel ill, or you can also have headaches. So I want to recommend that, again, you drink a lot of water because that will help prevent as many side effects. It's natural side effects. Your body is trying to push through and heal and mend from all of the tension and dysfunction that you just released. But there are side effects with fascial scraping. How often should you scrape? I usually recommend once a week. You can do it often as long as you're not overdoing it in terms of like same area, too much, a lot of redness, a lot of soreness. You do want to give your body a break. That's why we want to stretch and drink a lot of water, but at least once a week would be beneficial. Thank you for watching my video. I hope it was helpful. If you have any questions or concerns, you're welcome to reach out. My name is Dr. Alissa Gould with All Spine Chiropractic and Wellness.